As the country battled the coronavirus pandemic, the health ministry had the responsibility of securing the nation. But Afya House was rocked to the core by the KEMSA scandal that dragged Health Principal Secretary Susan Mochache right in the middle of the storm. Mochache says the scam could have been avoided only if KEMSA did the right thing. Sam Ogina reports.
She has weathered stormy, turbulent waters of 2020, fighting for the survival and the soul of the country not to be consumed by the COVID-19 pandemic. That same fight nearly consumed her.
It is a difficult time because we are all human. And so you get hit very hard and you feel very battered. But then, as days move on and as clarity begins to come out and, things begin to settle down, then, you realize that actually you can go through almost, you can go through a lot. You then realize that you understand what it means. And I'm sure that if such a thing happened, I would be in a better place than I was this time around. It's hard, but it leaves you, yes, a bit more stronger.
When the global COVID-19 pandemic hit the country, with the country's first case reported on March 13th, all focus was at Afya House and, by extension, its officers. The ministry's brief was simple: to secure the nation, minimize loss of life and manage the spread of the disease.
We had such a strong, robust, dynamic team of people helping us to think through COVID. And every decision that was made in this country about how we are dealing with COVID, I must say, was humbling that it came from the task force. Everything that came from there fed itself upward to cabinet and to some of the, the protocol direction that even His Excellency the President gave. And I remember at one time he recognized and said, I am just doing what I have been advised by the experts.
As the country was gripped by the jaws of the pandemic, trouble was fomenting at Kenya's Drugs and Medical Supplies Agency, KEMSA, an appendage of the Health Ministry. A 7.6 billion shilling scandal was brewing that would implicate Afya House top brass.
Was there any individuals who were forcing you to make some of these decisions outside the board sanctions?
There were requests from the PS.
Okay.
There was request from the cabinet secretary.
Which PS? He's going to give us names.
Was it written?
Susan Mochache.
Yes.
There were requests from the cabinet secretary. We've said Honorable Mutai Kagwe.
Calls we make, follow-ups we do. Because now with a pandemic, sometimes the labs don't have certain items they require. We already requested KEMSA to procure. There is a delay. Won't I call to find out what the problem is? Won't I call to find out where we are on some PPEs that we have requested to be delivered? So isn't the minister not going to be bothered if he finds out we are running out of test kits and he wants to know what KEMSA is doing about it? So, we talk with the state corporations frequently, and particularly in this difficult time.
And just like that, the fire was lit and it would burn like an inferno.
2 aid agencies have now threatened to withdraw up to 400 billion shillings that's been earmarked for Kenya because of the KEMSA scandal.
Kenya's Global Partners Global Fund and USAID threatening to withdraw support from critical healthcare programs given the rot at KEMSA. Kenya risks losing 400 billion shillings in aid due to the KEMSA mess.
And for KEMSA, they only needed to buy what was needed within the funds that were available. And that is really what it is. So even with COVID, I think it is another misconception that the money is in Afya. It really is not. It goes to the different state corporations who are also at the front of this COVID battle. How is it that, when other state corporations do some of the things that we see out in the media, ministries are not pulled into it. So in this case, we were dragged right into the issues that were going on at KEMSA, and that surprised me. But then again, you can't run away from it. It's an institution that it's within you.
With KEMSA clashing with its parent ministry, Afya House needed to present a united front against the onslaught.
If anything, these difficult times brought us, closer together, because I think my minister, I must appreciate, really stood solidly and gave us the leadership, and he was there for us. And I remember when we were called, there's a time we were asked to each go to Senate and respond to these questions of Parliament, separately. And he said, no, we are going to go together with my PS. So he has been extremely, extremely supportive and very encouraging.
The rot at KEMSA not only angered the nation but also got the attention of the president. President Uhuru Kenyatta delving into the saga, directing investigative agencies to swing into action.
The Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online, so that we can see who has been awarded a tender, we can see what is the value of that tender.
We've moved KEMSA onto the IFMI system, which is a very good system, and they are 100% on it, and it is available online for anybody to see. We are quite privileged to have our development partners working with us this journey, so that KEMSA can emerge even more stronger.
For Mochache, it was a battle for survival to salvage her job, her reputation, and at the same time, salvage the country from a pandemic.
I think in my view, a mafia is somebody who doesn't want to follow the due process. That's what I would describe as a mafia. And certainly, we've had some cases where, we've transferred people and they just don't want to go. Yet, the public service is very clear. You should be ready to work anywhere in this country. So maybe that, shows an element of mafia.
You have been patient for a very long time when you have been with those cartels. So, be a bit more patient during the fight against the same cartels. Cartels are not beaten overnight. They fight back. You have no idea how bad it is. You are just mentioning KEMSA here.
But as the accounting officer, the principal secretary feels, Afya House has been misconstrued as a den of corruption.
The ministry is stereotyped. Actually, that's what I should say. It's stereotyped. Because, to be honest, with devolution, a lot of what used to happen in Afya and the kind of resources that used to be there are no longer there. Health is a devolved function. So it's unfortunate we continue to carry that tag that we earned before devolution. And of course, when some of our officers refuse to be transferred, and some of these issues also come out, playing out in the public gallery, then of course it doesn't help us. It just works to reinforce the stereotype that exists about Afya House.
But why does Afya House attract all the troubles within the public sector?
There is quite a bit of misperception out there about the Ministry of Health and how it has a lot of money. And I think it was correct to say that before devolution. But with devolution now, I can tell you the bulk of our budget, actually about 95% of it, simply moves to different institutions. We have got service areas which take money. So if you look at what's left actually in the ministry headquarters, it's just about 150 million, 200 million. The rest of the money, to be honest, as a PS Ministry of Health, I'm just a conveyor belt.
Mochache has been accused of being abrasive, brazen, and wielding a lot of influence within the corridors of Afya House.
It's true. I mean, you sign off all these resources. But, the people who are heading these institutions, they are also accounting officers. They have obliged to work within the law. It's not that they receive the money to do what we tell them to do, even if I wanted to direct them. They have a process to follow, and they are answerable to a board. So we don't have that kind of control that people imagine that we do. We actually don't. There is this perception, of course, that, as a PS there, you sit on quite a bit of money, while the actual truth is you don't. KEMSA has its own board. It has its own operations. Kenyatta National Hospital likewise. MTRH the same. KMTC is also a huge institution, but it has its own board. So literally sitting at the Ministry of Health, it doesn't have the kind of money people imagine that it does.
She has fought, she has been battered and bruised, but remains steadfast, saying she has drawn valuable lessons on a personal level and for the country's health sector.
We have learned now with COVID, more than ever, a health insurance is one of the most important things that anyone should have. I think COVID helped us to realize that really there are things we shouldn't be importing. You can't be importing a PPE. We can't be importing some of the lab reagents that we use. And, we can't be importing gloves, masks. We must embrace the Make Kenya and Build Kenya motto.
Sam Ogina, Citizen TV, Nairobi.